When I decided to go to medical school, I decided to go specifically because I wanted to do primary care in underserved areas. So the scholarship program was a perfect fit for me. I'm really excited that I was given this opportunity.
It is a home environment, and whether they choose a beach, a rural western area in our state, or if they choose to go to the inner city of Wilmington or in our state capital of Dover, there are a lot of opportunities in the 7 health systems.
And Delaware is a great place for health professionals to get training in primary care. We've got some great residency programs. We also have a great variety of places in which you can select to live.
The benefits of having a provider come to a federally qualified health center here in the state of Delaware is that there is a state loan repayment program. The FQHC gets the benefit of fresh new talent, and the provider gets the opportunity to have loan forgiveness, which actually boosts that salary a little bit.
The National Health Service Corps program is one of the reasons why I decided to go to medical school in the first place.
And this program places providers in health professional shortage areas to make sure that we have enough care providers out there for the underserved population. It offers several different loan repayment programs as well as scholarships. These programs are offered in HPSA designated areas. They're offered in medically underserved areas.
We've done a few things to expedite credentialing and make it a more efficient process. The Delaware Division of Professional Regulation launched a new software program called DelPros, which now you go online, the application's digital, it's automated. The state joined the Interstate Medical Licensure Compact. And what that does is states that belong to this compact, you can apply for expedited credentialing.
The Conrad Waiver J-1 Visa program focuses on international medical graduates who have completed their graduate medical education in the United States and they want to remain in the United States or they want to remain in Delaware. What this program does is it allows up to 30 visas annually per year for those graduates to work in a HPSA designated or medically underserved area, and it waives the requirement for them to have to go back to their home country of nationality, which would be something if you want a regular J-1 visa that you would have to do.
One of the great things about Delaware is our federally qualified health centers. They receive funding to fill the gap as safety net services for people who are uninsured and underinsured.
We do not turn individuals away because of their ability or inability to pay. We also try to wrap services around the individual when they come in. We sit down with them and we have individuals that screen the family or the individual to see what resources are available for coverage as it relates to receiving healthcare services, as well as connecting them to other resources.
Working in Delaware provides a lot of really great opportunities to get the care that I need to the underserved population. It was really important to me to serve that population in particular because that seemed to me to be the biggest injustice. And so I wanted to make a difference there and even the playing field for people a little bit.
As a psychologist, I would say that one of the biggest challenges that I see in Delaware as it pertains to children and youth would be a shortage. We certainly need more mental health providers in almost every field.
We need to be able to provide services. There are so many people who are suffering, who do not have the ability to seek out services.
There is also opportunity for oral health in our state. In addition, we have a relationship with Temple for those who are pre-dental and go on to dental school at the Temple Dental Program and have the DIDER program. And so again, dentistry in our state is one in which practices at the highest level.
One of the great things about BB Healthcare that we're doing right now is building a family medicine residency program. Being that this is a new program, we're looking for residents who want to hit the ground running, residents who are flexible, really want to be a part of something new, something the historic, a part of BB Healthcare.
In addition to my work as a psychologist, I also work as a diversity, inclusion, and health equity practitioner. I'm really working within healthcare systems and institutions to ensure that the workforce that presently exists can provide care at a level that is highly culturally responsive, culturally sensitive, and culturally competent.
For persons who are looking at diverse communities, and if you are a professional coming from brown, black community or wanting to develop, this is a warm, friendly, nurturing state.
People work together across sectors, support one another. We're probably one of the only states in the nation where the governor and the CEOs of our hospitals can get on a weekly call together and tackle our challenges together.
Delaware is a really fun place to live. It has access to anything you would want. There's lots of outdoor activities to do. There's parks and playgrounds in every neighborhood. It has been a really great place to live.
I really hope they check out Delaware because we really are a role model and an innovator in the state and across the country.